If you have ever sat on the toilet feeling stool stuck right in your rectum, pressing, ready, and it simply refuses to move no matter how long you sit or how hard you try, I need you to stay with me for the next few minutes, because what I am about to walk you through today could change your mornings, your comfort, and honestly, how you feel about your own body. Here is what almost nobody explains properly. That stuck, pressure-filled, won't budge feeling is not the same thing as ordinary constipation. It has its own name. It has a specific cause inside your body, and it has a set of very precise fixes, most of which your doctor probably never had time to walk you through in a 12-minute appointment. By the end of this video, you are going to understand exactly what is happening inside your body when this occurs, and you are going to walk away with 6 practical strategies you can start using as early as tonight. But before we get into any of that, I want to hear from you. Type your first name and your age into the comments right now. Tell me how long this has been happening for you. I promise you, when you scroll through the comments on this video, you are going to see just how many people are dealing with the exact same thing, quietly, without ever bringing it up to anyone. You are not the only one. And if this channel is new to you, hit subscribe and tap the bell, because we cover the health questions people are too embarrassed to ask out loud every single week. What's actually happening in your body? Let's start by clearing up a mistake almost everyone makes, including plenty of people who have been dealing with this for years. We use the word constipation for everything. Can't go easily? Constipation. Haven't gone in 4 days? Constipation. Feel something sitting right there that will not come out? Also constipation. But that last one is not ordinary constipation. That is something more specific, called stool retention, and in more advanced cases, fecal impaction. And the fixes for ordinary constipation, more fiber, a stool softener, patience, do not always work for this. Sometimes they make it worse. So let's talk about why this happens, starting with a piece of anatomy that almost nobody outside of a gastroenterology textbook has ever heard explained clearly. Your large intestine's main job is to pull water back out of digestive waste as it travels through. That's it. That's the whole function. Water goes in loose, water comes out, and what's left behind gradually firms up into stool. By the time that stool reaches the rectum, the final holding chamber before the exit, it's supposed to be formed, but still soft enough to pass without a fight. Here's the part that changes everything. The rectum is not a straight pipe. It bends. And holding that bend in place is a sling-shaped muscle called the puborectalis. When you're standing, walking, going about your day, this muscle is doing you a favor. It keeps that bend tight, which keeps stool safely up and out of the way, so you're not dealing with accidents. But the moment you sit down on a standard toilet at a 90-degree angle, that same muscle is still clamped down, still holding that bend tight. And now, it is working directly against you. It creates what is essentially a kink at the exit point. You are not failing. You are not weak. You are, quite literally, fighting your own anatomy every time you sit on a modern toilet in the position it was never really designed for. Now here's where the real problem builds. When stool sits in the rectum longer than it should, whether from that muscular kink, from not drinking enough, or from a slower digestive system, your intestine doesn't stop doing its job. It keeps pulling water out. The longer that stool sits, the more water gets absorbed, the harder and drier it becomes, and the harder it becomes, the more difficult it is to pass, which means it sits even longer. It is a cycle that feeds itself. And left alone, it tends to get worse, not better. This becomes especially common as we get older. The natural squeezing motion that pushes waste through the intestine, something doctors call peristalsis, naturally slows with age. On top of that, a long list of common medications, blood pressure drugs, certain pain medications, iron supplements, some antidepressants, all tend to slow the gut down even further as a side effect nobody warns you about. And many older adults are walking around mildly dehydrated most days without ever realizing it, because the sensation of thirst also becomes less reliable with age. Clinical reviews on this topic estimate that fecal impaction, the most severe end of this spectrum, is significantly more common among older adults than most people assume, and it's frequently misdiagnosed. In fact, one of the more surprising findings in the geriatric medicine literature is that what looks like uncontrollable leakage or minor incontinence in an older adult, is very often not weakness of the sphincter at all. It's liquid stool finding its way around a hardened, blocked mass higher up that simply cannot pass. Treat only the leakage, and you miss the actual problem sitting behind it. So now you understand what is actually happening, and why it happens more as we age. The real question is what you can do about it, starting today. And the very first strategy is so simple that most people laugh when they first hear it, right up until it works. Strategy 1. Fix the angle, not the effort. Forget pills and supplements for a second. Strategy 1 costs about the same as a cup of coffee, and it is, without question, the single most underused tool in this entire conversation. It's a small stool, a footstool, 6 to 9 inches tall, placed in front of your toilet. Remember that puborectalis muscle holding your rectum in a kink? When you raise your knees above your hips, the way you naturally would if you were squatting, that muscle relaxes and the kink straightens out into something much closer to a straight line. Suddenly there is nothing in the way. This isn't a wellness trend or a gimmick you saw in an ad. It's basic mechanics. Researchers who have studied defecation posture directly, comparing a normal seated position to a squat-assisted position, have consistently found shorter straining time, less pushing effort, and more complete emptying with the knees elevated. One frequently cited comparison found that the time spent straining dropped by more than half simply by changing the angle of the hips and knees, with no other change at all. You don't need to buy anything elaborate. Any sturdy step stool works. Place it in front of the toilet. Rest your feet on it every time you sit down, and lean your torso slightly forward. That's the entire strategy. Many people notice a difference the very first time they try it. Type the number 1 in the comments right now if this is new information for you. I genuinely read these, and it helps me understand which parts of this video are landing. Strategy 2. Hydrate with timing, not just quantity. You've heard, drink more water, more times than you can count. So let me give you something more specific than that, because the timing here matters more than most people realize. Here's the honest truth. If stool is already hardened and sitting in your rectum right now, chugging water today will not soften that particular mass. That stool has already gone through the water absorption process. What proper hydration does is protect tomorrow's stool from becoming just as hard. For the stool that's already stuck, the more immediately useful tool is a full glass of warm water first thing in the morning. Before food, before coffee, warm liquid triggers something called the gastrocolic reflex, a signal that tells your intestines, food is arriving, start moving things along. This reflex is naturally strongest right after waking, which is exactly why so many people feel the urge to go shortly after their first cup of something warm. Using that reflex deliberately, rather than accidentally, is one of the most reliable and completely free interventions available. Strategy 3. Choose the right kind of fiber. Fiber trips more people up than anything else on this list, because most fiber advice is written for ordinary constipation, not for stool that is already stuck. There are 2 categories of fiber, and the difference matters enormously here. Soluble fiber absorbs water and turns into a gel-like substance as it moves through your digestive tract. That gel coats the stool, keeps it lubricated, and holds moisture inside it, keeping things soft and easier to pass. You'll find it in oats, apples, pears, psyllium husk, and most legumes. Insoluble fiber works completely differently. It doesn't dissolve. It adds bulk and mechanically pushes material through the intestine. That's what you get from raw vegetables, wheat bran, and most whole grains. Here's the mistake almost everyone makes when stool is already stuck. They reach for more insoluble fiber, more roughage, more bulk, thinking it will push things along. But if there's already a hardened mass sitting in the rectum, adding more bulk behind it is like stuffing more material behind a cork that's already jammed in a bottle. It raises pressure without solving anything. When stool is retained, lead with soluble fiber instead. 2 foods come up again and again in the research on this specific problem. First, prunes. They contain natural sugar alcohols that pull water into the intestine and a plant compound that gently stimulates intestinal contractions. Several clinical comparisons have found prunes outperform standard fiber supplements like psyllium for improving both stool frequency and consistency. Second, Kiwi fruit, eaten with the skin if you can tolerate it. Research comparing daily kiwi consumption to standard fiber supplementation has found it works just as well, with noticeably fewer digestive side effects like bloating and gas. 2 prunes or 2 kiwis a day, consistently, is a small enough habit that it actually sticks, and that consistency matters more than the exact food you choose. One more thing worth knowing here. Soluble fiber only works its softening magic if there is enough water available for it to absorb. Adding a fiber supplement without also increasing your fluids is one of the most common mistakes I see, because it can actually make a hard stool feel even more stuck in the short term. Pair any increase in soluble fiber with a genuine increase in fluids across the day, not just that one morning glass of warm water, and give it several days before you judge whether it's working. This isn't a same-day fix. It's a build-up effect. And most people notice a real difference somewhere between the 4th and 7th day of consistent use. Planning to actually try strategy 3? Drop the word fiber in the comments. I like seeing which strategies people are genuinely planning to use versus which ones just sound nice. Strategy 4. Move your body right after you eat. Strategy 4 surprises people because it has nothing to do with what you're eating or drinking. It's about what you're doing, or more often, not doing, every single day. Your intestinal wall has its own independent network of nerve cells, sometimes referred to as the gut's second nervous system. It controls the wave-like contractions that push waste along, and it responds directly to physical movement. When your body is in motion, walking, light stretching, even puttering around the house, this system speeds up. When you sit still for hours, it slows to a crawl. For anyone dealing with stool retention, a brisk 15 to 20-minute walk, shortly after breakfast, stacks 2 effects on top of each other. The gastrocolic reflex, triggered by eating, and the intestinal stimulation, triggered by movement. Together, they build a genuine forward pressure that helps move waste toward the exit. I think of a patient I'll call Robert, 74, who spent most mornings in his recliner with the newspaper before doing anything else. He was going every 3 to 4 days, each time a genuine struggle. We changed exactly one thing, a 20-minute walk right after breakfast. Within a few weeks, he was going comfortably most mornings. He described it as finally getting his mornings back. Strategy 4 got you thinking about your own routine? Type the number 2 in the comments. I want to know which of these is standing out to you so far. Strategy 5. Stop overriding the urge. Strategy 5 addresses something that develops slowly, over years, through a habit that feels completely harmless in the moment. Your rectum has stretch receptors, nerve endings that fire the moment stool arrives and the walls begin to expand. That signal is what you feel as the urge to go. It has a window. Respond to it, and your body coordinates a smooth, complete evacuation. Ignore it, because you're busy, because you're not near a bathroom, because it's inconvenient, and the signal quietly fades. The rectum adjusts to the stool sitting there, the urge softens, and it gets pushed down the priority list. Do this often enough for long enough, and those stretch receptors become less sensitive. The threshold to trigger that urge climbs higher and higher. Eventually, some people stop feeling a clear signal at all, which means stool can accumulate without your body ever really telling you it's time. This is sometimes called rectal hyposensitivity, and it is one of the most overlooked contributors to ongoing stool retention. The fix sounds almost too simple, but it works. Respond to the urge every time it shows up, wherever you are. Every time you answer it, you reinforce that signal pathway. Every time you ignore it, you weaken it further. If your urge has already become faint or unreliable, you can rebuild it through scheduled bathroom time. Sit for 10 to 15 minutes each morning after breakfast. Footstool in place, no straining, no forcing, just presence and slow breathing. Many people find that reliable morning signal returns within a few weeks of doing this consistently. Strategy 6. Know your safe relief options when you're already stuck. Strategy 6 is for right now, for when the stool is already there and you need relief today, not next week. Let me be straightforward, because this is where people make decisions out of frustration that can genuinely cause harm. Polyethylene glycol, sold over the counter under names like Miralax, is generally considered a first-line, well-tolerated option for stool retention. It draws water into the colon to soften stool from the inside out, has essentially no taste, and is considered safe for occasional use in most adults. Glycerin suppositories work more locally and more quickly, drawing fluid directly into the rectal tissue and stimulating the urge reflex, often within 15 to 30 minutes. When stool is stuck close to the exit and feels right there but immovable, this is often the fastest available option without a prescription. What to be more careful with? Stimulant laxatives, particularly ingredients like senna and bisacodyl. Used occasionally, they're generally fine. Used constantly, over months and years, there is real evidence they can gradually affect the nerves of the intestinal wall, reducing your gut's own natural ability to move stool without help. The very tool people lean on for relief can, over time, deepen the underlying problem. And one more thing worth saying plainly. Straining harder is never the answer. Forceful, prolonged pushing raises pressure in the abdomen and rectum in ways that contribute to hemorrhoids, anal fissures, and in more serious cases, rectal prolapse, where part of the rectal wall pushes outward. None of these are minor inconveniences, and every one of them is avoidable. Quick pause here. If this video has been useful to you so far, and if you have a parent, a spouse, or a friend you suspect might be dealing with this quietly, send it to them right now. Most people never bring this up out loud. A share from you might be the thing that finally starts that conversation. And a thumbs up tells me to keep making videos like this one. Warning signs you should never ignore. Before we wrap up, I need to cover something just as important as everything else in this video. Most stool retention is manageable with the strategies above, but there are situations where this stops being a home problem and becomes a medical one. See a doctor promptly if you notice blood in the stool. Bright red blood is often from hemorrhoids, usually not dangerous but worth checking. Dark, tarry blood mixed through the stool is different and needs urgent evaluation. Pay close attention to constipation that starts suddenly and doesn't fit your normal pattern, especially after age 50 or 60. A new, persistent, unexplained change in your bowel habits is one of the earliest warning signs doctors look for with colorectal cancer. I'm not telling you this to frighten you. I'm telling you this because, caught early, colorectal cancer is one of the more treatable cancers we know of, and early is the whole game. Unexplained weight loss, alongside ongoing constipation, deserves a prompt conversation with your doctor. So does severe abdominal pain, vomiting, or a complete inability to pass gas, which together can point toward a bowel obstruction. That is a true emergency. Don't wait it out at home, and if you ever feel something physically protruding during straining, that may be rectal prolapse, and it needs a proper evaluation by a specialist. I share all of this not to create fear, but because I have seen people put off getting checked for months, sometimes longer, purely out of embarrassment. Your comfort matters, your dignity matters, and your life is worth more than a few uncomfortable minutes in a doctor's office. None of this means you should panic every time you have a difficult morning. The vast majority of what we've talked about today is ordinary, fixable, and nothing to be alarmed by. These red flags exist so you know the difference between this needs a footstool and some patience, and this needs a phone call today. Knowing that difference is its own kind of peace of mind. Bringing it all together, let's close with something I want you to actually walk away with. The 6 strategies we covered today. Fixing your posture with a footstool. Using warm liquid to trigger your morning reflex. Choosing soluble fiber over bulk when you're already stuck. Moving your body after breakfast. Responding to the urge instead of overriding it. And knowing your safe relief options when you're already stuck are not separate, unrelated tips. They work together as a system. The footstool solves the mechanical kink. Warm liquid kickstarts the reflex. Soluble fiber softens what's forming next. Movement pushes it forward. Listening to the urge keeps your body's own signal working the way it's supposed to. And knowing your safe options means you're never caught without a plan. There's a patient I still think about. I'll call her Margaret, 69. She came in for an unrelated checkup and mentioned, almost as an afterthought on her way out the door, that she hadn't had a comfortable bowel movement in well over a year. She hadn't told her husband, she hadn't told her children. She had simply decided this was what getting older felt like, and she'd been quietly managing it with over-the-counter stimulant laxatives every few days. We went through everything covered in this video. She was mildly dehydrated most days without realizing it. Her diet leaned heavily on insoluble fiber and almost no soluble fiber. She spent most of her day seated, and she had never once heard of the puborectalis muscle or why a small footstool might matter. A few weeks after making these changes, she called just to say she couldn't believe she had waited over a year to bring it up. The conversation was never the embarrassing part. The silence was the costly part. Here's what I want you to take with you today. That stuck feeling is not just constipation, and it's not something you simply have to live with. It has a specific cause, a clear mechanism, and doable solutions. Fix your posture. Trigger the reflex with warm liquid each morning. Choose soluble fiber first. Move your body after breakfast. Listen to your body's signal instead of talking yourself out of it. And know your safe relief options for the days you need them. But there's one piece we haven't touched on today, and for a lot of people, especially women, it's actually the missing piece. No amount of fiber, water, or timing fixes the problem when it's rooted in the pelvic floor muscles themselves. That's a completely different conversation, and it's exactly what we're covering in the next video. If this video helped you today, give it a thumbs up. It genuinely helps this channel reach more people dealing with the exact same thing. In silence, share it with someone you love. Subscribe so you don't miss what's coming next. And drop a comment below with your name, your age, and which of these 6 strategies you're going to try first. I read every single one. Take care of yourselves.